Seth Painter here with the Panagora Pharma Customer Experience Chatcast. Panagora known primarily for live events, chatting with all of your favorite pharma folks about all things CX. Joining us is Suzanne Kirkendall from Nudge. Say hello, Susan.
Hi, everyone. Very glad to be here.
Tell us a little bit about yourself.
So, I am a consultant at the BVA Nudge Unit. We are a global consultancy. We specialize in applying behavioral science to create successful behavior change. So, my role and background are kind of a combination of academic and private sector, public health, healthcare, psychology, and I lead our US healthcare division.
So you don't really find that combination very often.
No, it's something I've kind of worked my way into, but I really enjoy kind of straddling both worlds and applying the strengths of each to the other.
Well, let's apply that perspective to customer experience. In your opinion, Suzanne, what does customer experience mean to you?
So to me, customer experience is really about every touch point, every interaction that your target audience has with your brand. So when it's done well, it's about gauging people on a really emotional level, even if they don't realize it. And just, in very much in the nudge vein, it's all about how do you make it as easy as possible for them to reach their goals and you and your business to reach your goals in a synergistic way.
So expand on that a little more. How does customer experience layer on to what you're doing at the BVA Nudge Unit?
As you can imagine, it's never too far from the work that we're doing. So as a behavioral scientist, when I'm thinking about the target audience, whether that's going to be the patient, the HCP, the rep, anybody else in the healthcare ecosystem, I'm always thinking about a few things, right? So I'm thinking about what's driving them from a psychological perspective. What are the barriers between where they are and where we want them to be behaviorally? And then how do we make it as easy as possible for them to get from A to B? And we'll use that using our proprietary tool called the drivers of influence. And I know a lot of this probably sounds a little bit similar to how people might normally approach CX, but we dial it way up by using that behavioral science lens so that we can dig way deeper and influence much more effectively and subtly, all of which is going to result in a better CX for your customers.
I think you hit on something there where you say it sounds very familiar to what a lot of other folks are talking about CX. And after doing this for many, many, many years, you see that CX is somewhat like sociology, where people say, oh yeah, that's common sense, we can do that, but people aren't really doing it. And it's nice to be able to know that there are tools and resources like yourself out there to help make this happen. When we think about the customer's behavior, a lot of the responsibility is placed upon the pharma company to say, let's create a perfect CX. Let's think in terms of customer centricity. Let's build and design this perfect customer experience for our patients, for our HCPs, whoever the target audience happens to be. But what is the role of the patient in all this? When you think about that, what is their responsibility in terms of their behavior and changing their behavior in order to produce a better CX?
An interesting question. And what you'll find is we often work on both sides of the equation, right? We look at how do we change the patient's behavior? How do we change internal behavior at the company? Because actually what you'll find is if you influence employees to have a really good experience, that has a trickle-down effect on your patients and on your other customers. But when it comes to the patients and their behavior change, I think if we want to use the word responsibility, I think their responsibility is really to be themselves, because we've worked around that by using our behavioral science lens and understanding of who they are, what they want, how they behave, to meet them where they are. So by changing their behavior, it's going to work for us both in a positive way. But their responsibility is really just to show up, and it is still very much on the pharma company to make that as easy for them as possible.
But can we, and I'm going to clarify here, we're not talking about changing their therapeutic behavior and things such as compliance and adherence. We're talking about changing their behavior to make them more interactive with the experience that is laid out before them. And so it's kind of a fine line because they're oftentimes, very intertwined. So, can you change the customer experience by changing the behavior with which they interact with that experience rather than taking a build it and they will come approach to it, build it, but then try to change the behavior to get them to come.
Yeah, no, that makes sense. And I think what we always try to do is, we talk about nudging for good, and we talk about win-win approaches. And so that's a really good example of that, where you do want to change their behavior, but you want it to be a good experience. And I don't think you can have a good CX if you're not changing patient behavior to some degree, right? You are trying to make it as smooth as possible, and it's not going to happen without a little bit of change. So I think, yes, absolutely, there's behavior change to be done to augment that CX and make it more positive. And there are lots of subtle ways to do that. It doesn't have to be major, but it's all about just removing friction wherever possible.
So you would say we can nudge them towards different behaviors in order to embrace
That is the
a
key
better
word.
customer experience.
Exactly.
I had to do it. I had to do it. So a lot of that you're talking about is psychological, but there's also the tool that you mentioned and the various tools that are at our disposal here, digital. And in this day and age, is digital customer experience? Is customer experience digital? Can the two be separated? Should the two be separated?
Yeah, it's a good question. I would argue that any digital moment is, of course, part of CX, but you can have moments of CX that are outside of digital. So I don't think they can be completely separated, but they're very much intertwined. And it's important, especially now that we focus more on the digital, given the current environment, but not to forget the rest of the context in which that person lives. We always talk about context is king when it comes to understanding your target audience and changing their behavior. So of course you need to think about the digital context, but as broad as you can get with that context and as specific as you can get, the more effective you'll be able to be.
So what's next for pharma and customer experience? Is there anything that they're doing really well? Any areas where they could improve? Or what's coming down the pike?
Yeah, it's an exciting space to be in because I do think there is a lot of change happening. From my perspective, I would argue that, everything is going to get ever more personalized, ever more one-to-one. We talk about this a lot as a goal, but I do think we are going to start really moving in that direction more and more as we, enhance our big data tools and combine them with that behavioral science lens. I think more and more touch points are going to be specifically designed from the ground up with a behavioral science lens, because we're seeing that when you do that as a foundational level, it's much more effective. It's a much more efficient investment as well. And you're going to get the outcomes that are win-win for everyone. So I think other things are just going to be looking at habits and their roles, really just humanizing the CX, because I think a lot of times it turns into more of a UX conversation, right, as opposed to a human-centric conversation. So always bringing it back to that, communicating in ways that people really understand, and just making sure that we build everything with those psychological and human principles in mind first and foremost.
Yeah, I think the HX versus UX discussion is one that we could probably spend a couple hours on.
Oh yeah, don't get me
If we had the
started.
time. So, thank you very much, Suzanne. Will we be seeing you in September at the Panagora Pharma CX Summit?
You will be. I'm very, very excited. We'll be presenting a bit more about Nudge and how it'll help you with your CX. So very much looking forward to meeting everyone else there.
So, thank you very much.